I would say my postpartum experience was a lot more challenging than I had initially expected. I'm still seeing Anne for physical therapy from a pelvic floor, and we're at 10 months now. We're making progress, but I mean, so many women have no support at all. And I mean, I can't imagine doing this at all without the support system that we had. So I feel really lucky. Hi, our name's Meg. This is Charlotte. She is 10 months old. I started seeing Anne, who's a pelvic floor physical therapist, when we were admitted into the hospital for abdomen pain. She did some work on my womb, and I think she might have rubbed my back a little bit and maybe did some dry needling on my back, but we didn't do anything with my pelvic floor that day. And then she said, "Meg, you're really looking pale." And I said, "Oh, I'm not wearing any makeup." And she said, "I think I'm going to take your blood pressure." And so she took my blood pressure and then called my primary because the blood pressure was elevated. So we didn't have a consistent high blood pressure reading, and so there was a lot of wavering on and off about what we should do about it. So we ended up being admitted into the hospital for 24 hours of observation. So they took my blood pressure every hour for 24 hours. And then the blood pressure wasn't consistently elevated, so we were discharged. And then we got home, and I think the next day we had another really elevated blood pressure reading. My husband is a firefighter, so he was taking all my blood pressure readings for me. So we went to the ER. We called Beaupre and she said, "Go to the ER." And the ER doctor couldn't get an elevated blood pressure reading, and I also was having a headache. That was the other thing, like a pretty severe headache. So the ER doctor discharged us. And then we had another appointment for Charlotte, so that was lucky. So we went to go see Beaupre, and then we ended up being admitted for the magnesium drip that day. I kept telling Dr. Beaupre, I was like, "I haven't slept in like a week. That's the reason why I have this headache, you know? I mean, it's a lot of work to care for a newborn." And I had, my husband was off and my mom was here. I had a pretty good support system at home. So I feel like Anne is really sensitive to like each individual patient's normal and not just the normal that's on the paper. And so I had pretty low blood pressure my entire pregnancy, and that is normal for me, not pregnant as well. And so my elevated was not necessarily, what elevated is on paper. So I think Anne viewing what is specific to each patient as normal was really critical. I would say my postpartum experience was a lot more challenging than I had initially expected. I'm still seeing Anne for physical therapy from a pelvic floor, and we're at 10 months now. We're making progress, but I mean, so many women have no support at all. And I mean, I can't imagine doing this at all without the support system that we had. So I feel really lucky. I would say advocating for yourself is pretty critical, and it's easy to get wrapped up in the baby with the doctors and everything. And I feel as though Anne is really good at her job, but also she really addresses patients as individual people, and I think she has a really holistic view. Her specialization's in physical therapy, but she does a really good job of looking at the whole picture, and I feel like that is great for recovery and for catching things that are maybe not, directly within her realm. My husband came to a lot of our appointments too, and we felt like, in terms of all of our support team, that Anne was definitely the most supportive person that we had, which for a physical therapist is really impressive. But if you're not healthy, then you can't take care of your baby, so it's critical to be healthy as well.